Hey guys, Lauren Losing here, and this is my day before plastic surgery video. I am 2 years, 9 months post-op vertical sleeve gastrectomy surgery, which I had on August 21st, 2013 at Massachusetts General Hospital with Dr. Denise Gee. My first appointment at the weight center, I was 269 pounds. Day of surgery, I was 245.5. Last week when I weighed myself, I was 126.5, and I didn't weigh myself this week. I'm one of those people who I want to weigh myself tomorrow morning, and that will be my official pre-plastic surgery weight. So let's get into the stats of my plastic surgery, even though it hasn't happened yet. I am having plastic surgery at Massachusetts General Hospital with Dr. Amy Colwell. I am having a brachioplasty, which is an arm lift. I am having a mastopexy with augmentation, which is a breast lift with implants. They're going to be silicone implants. And I am having a belt lipectomy, which is a 360-degree lower body lift. I am feeling great. I might get emotional in this video. I actually started to get, I don't know if anyone picked up on it, but I started to get slightly emotional right from the beginning of this video. I feel really good though. I think most of my nerves I went through a few weeks ago where I was kind of freaking out about everything. I thought something was going to happen to stop this surgery. I thought that I was freaking out about infection after, about not liking my results after, although that was more of an internal freak out. I didn't really freak out to anyone else. I'm actually not that worried at all about not liking my results after. I just, I've said this several times, I'm trying to manage my expectations. I don't expect to look like a Victoria's Secret model after. I don't expect to look like someone who has never had surgery, because I obviously will have surgery, never had a weight issue. Obviously I will still have stretch marks. Some of that will get taken away with the skin, but there are other areas of skin that are not going to be removed that'll still have stretch marks and all that. But just looking at everybody else's results, I think that I actually put my expectations way too low. I think that I'm going to be extremely pleased with my results, which is great. So I guess that goes over how I'm feeling. I am starting to get a little emotional. I can't believe that this day is here. I have wanted this for so long. I knew that from the day that I decided to have weight loss surgery is pretty much the day that I decided to have plastic surgery. I knew that one wasn't going to happen without the other, for me. And so, I had thought, I had the thought of weight loss surgery in the back of my head for years, but I didn't seriously plan on having weight loss surgery until December of 2014. So it happened within 9 months. This is something that I have been looking forward to for years. So I'm so happy that it's finally here. I made a lot of sacrifices to get this to happen, which is not something that I don't like to dwell on. Like, this isn't negative, but like, this isn't really something that I've touched on before. And it kind of goes into the response video that I wanted to make to Mamma Mia that I just did not have time to do because I've been doing so much to get ready for my surgery. So I'll kind of insert it in here. You can't have it all. You just can't. So I think that, making something a priority and making sacrifices to reach your goal is just a reality. And I mean, I would love to be living on my own, have my own place, have an active dating life or a boyfriend or like all these things. And I mean, I know some of those things I sacrificed that didn't necessarily have to be sacrificed, but yeah, you can't have it all. is a very uplifting video, but so that's my very blunt and direct and non-sugar-coated way of saying that to get what you want, you need to make sacrifices sometimes. And I sacrificed moving out of my parents' house, being seen as an independent adult, and all these things because I knew that I wanted this surgery. So the fact that, like, all of my sacrifices are, like, that I put towards this big goal, like, that this is finally here, it feels really, really good that all of that sacrifice was worth it. I'm glad I'm getting this out because I think that this has been brewing for a while, and I would not let myself feel this until now. I wouldn't let myself feel like I had actually accomplished it until, you know, it was going to happen, because like I said, I was convinced it was going to be taken away from me and that all of that sacrifice was going to be for nothing. So after I turn off this video, I'm sure I'm going to be crying even more to myself. Okay, so let me get into some other things. I'm gonna review with you, I guess, my little day before surgery list that I made. So I need to shower and shave. I actually just went to a very last minute waxing appointment. I need to pack a hospital bag. I might actually just wear to the hospital what I'm planning on wearing home. I'm gonna be there for one night. I'm gonna be pretty out of it, in pain, not able to move much. So I'm really not going to need anything else besides what I need to take home. Set up my medications for the coming week. I still need to do that. Remove my nails and polish. I still need to do that. Take out my contacts because you can't wear contacts during surgery. I'm going to do that tonight. Take out all piercings, and I put that in caps. I took out all of my other piercings except my nose ring. I ordered plastic spacers so that this wouldn't close while I was in surgery, so I'm just waiting for those to arrive and I will be taking this out. This is kind of a funny one. Change tag/timeline settings on Facebook. So the way I have my settings on Facebook right now is I have to approve things before they get added to my timeline, because I'm going to not be active on Facebook for a while. Although Lindsay Fly, if you see someone posting under my name, Lindsay Fly is going to have access to my Facebook, so she's going to be posting for me. But I didn't want her to have to, like, add all of my I'll add all my tags to my timeline and stuff like that. So it's gonna be a free-for-all. And because you guys are so amazing and have been tagging me and contacting me, let me just get the thank yous out of the way now. Thank you to absolutely everybody who has mentioned me, thought of me, sent a message, texted me, called me, FaceTimed me, all these things. I have had, like, this outpouring of love, and I really, really appreciate it. I literally wrote down, tweeze all of the hairs. I'm not going to be able to tweeze my eyebrows for a while, and, you know, I have some erroneous hairs. I'm part Italian. Hair grows where it shouldn't. So I wrote that down to remind myself. Do my measurements and skin flick. My skin flick is going to be attached to this video. I actually just filmed it. I'm filming this part second. So, and I did my measurements. I did my left arm, my right arm, my waist, my belly, and my hips. I did not do my chest because I don't really care how many inches it increases. It's obviously going to increase. So my left arm is 12 3/4 of an inch. My right arm is 13 inches. I think I mentioned in my skin flip video that I thought my left arm was a little bigger, but apparently it's my right arm. My waist, which is just the smallest, like the smallest point on my torso, is 28 inches. I do not have a very small waist. I've mentioned this before. I have much more of an up and down figure. So, not that I expect, you know, everyone to be comparing to me, but if you look at my waist measurements and be like, hey, I actually have a smaller waist than she does, or we have the same size waist, but she wears a smaller pant size. Pant size is much more determinant on your hip size than your waist size. Random fact to throw in there. My belly, which is just, you know, the biggest part of my stomach, is 32.5 inch, and my hips are 35.75 of an inch. So my hips are very small. So I'm not even sure if my hip size will go down. I know my arms are going to go down, and I know my waist and belly will go down. I'm not sure about my hips, but I figured I'd just throw it in there. So the cleaners are here. So I'm actually going to have to do the rest of this video like in my car or something, or in another room. So I'm sorry, they have to come in and clean my room. So be right back. So they're cleaning my whole entire house. So other than sitting in my car, you guys get to enjoy this beautiful background. I think I've only filmed one video out here before, and it was my first diet bet video, I think about 30 pounds ago. So once again, there's going to be a lot of nature sounds, but I'm almost through this video, I think. So something I wanted to touch on is that I mentioned in my last video, or in my plastic surgery frequently asked questions, that I didn't ask for an estimate of the amount of skin that would be removed. But knowing that I am living in the mid 120s right now, you know, mid to high 120s, it's possible with so much nature. It is possible with the skin removal. I really think that I'm going to need very little liposuction. I think the most amount of liposuction that I'll need is on my love handles and like the top of my abdomen, the top of the center of my abdomen, but I don't think much is going to be removed with lipo. But between the skin removal, the lipo, and just what I am expecting to be restriction and lack of interest in food after, it is possible that I will get to a place, and I mean, maybe I'll maintain it, maybe I'll come back into the 120s, but it's possible that I will be living in the 1-teens. And that is a place that I am just completely unfamiliar with, and it's I'm excited for that possibility, but it's also I don't know, it's throwing me off a little bit. I think I'm probably thinking about it a little too much, but that would be amazing. And like I said, I don't know what that's like. So I've mentioned that I am at my lowest adult weight, but I was around this weight when I was a freshman in high school. So it's still like, that was 16, 17 years ago, but it's still slightly tangible to me. 1-teens is not. I have not been in the 1-teens since I was about 10 years old. So, that thought is, I kind of hope it happens. I think that would be so like unbelievable, but, yeah, that's just the thought that's been going around in my little mind up here. I did make some notes. I didn't want to forget anything, because, you know, I thought that this might be a bit of an emotional video. I've mentioned before how I kind of have the inability to think and feel at the same time, so I just wanted to make some notes of things that I wanted to make sure to touch on. So I had a Google Hangout on Saturday with some soon-to-be plastic surgery patients and some what I've referred to as my plastic surgery gurus. So it was Tanya VSG 2011 is her YouTube name, Gracie, No One's Stopping Me But Me, Patty, who's Watch Patty Melt. So those three have had plastic surgery, and then it was me, Amy, who is now Amy Gets a 360 on YouTube, and Lisa, which I think Lisa is Lisa's VSG Journey. I think that's her YouTube name. So we had about an hour of a Google Hangout. People had asked if we were going to broadcast it, and it was just girl time for us. I I do share a lot of my life and a lot of my journey with everybody, and I just selfishly wanted that time just for us. It's a thought to do in the future. Maybe after, well, obviously after my plastics is tomorrow. Oh my God. So maybe after, like several months after plastics, we might do like a live Google Hangout one-time thing where people can ask questions and we talk about our experience and stuff like that. But this was just for us. It was good. It was nice to, you know, have some real talk. So Lisa's from Australia, so it was very interesting actually to compare how they do things there and how they do things here. She just posted a video, and I added it to my watch later, so I haven't watched it yet. So I don't know if she kind of touches on some of the differences, but like they don't use drains there at all. She said that they really consider it antiquated, and I don't know any surgeon in any plastic surgeon in the United States who doesn't use drains. So that was interesting. She is staying in the hospital for 5 days, I think, or maybe even a full week. So, and I'm staying for one night. And I think that, I mean, if I wasn't having the amount of surgeries that I was having altogether, I think I would go home same day. So, that's also a very interesting difference. But all in all, it was just great. I really appreciate those ladies taking the time out to answer our questions and to just, for everyone to just hang out and to have some girl time. So shout outs, besides everybody who has already, you know, reached out to me, all that stuff that I already mentioned, there are a few ladies coming up in the next couple weeks or even today who are having plastics. So, Alicia, I think her YouTube name is Miss Beautiful Alicia, is having her breast lift and reconstruction today. So good luck to Alicia. I think she's probably in surgery right now. Lisa, who I just mentioned, is having her plastic surgery exactly a week from tomorrow. So exactly a week behind me. We've been, you know, corresponding a lot, and I wish her the best of luck, and I know she's going to have amazing results. And then someone who I didn't know was having plastics, because I don't know if she's making videos about it, but I mean, she mentioned it on my Facebook, so I hope it's okay for me to mention here, but Kylie, Kylie Chasing Dreams was her YouTube name. I honestly don't think that she's posted videos about her plastics, but she is apparently having her plastics in 2 weeks. I don't know exactly what she's having, but good luck, Kylie. Kylie was very sweet to me, always, but when I was having a hard time last year, she's like sent me a care package, and it was really cute. And then of course Amy is having pretty much exactly the same surgery that I am having, except that she is getting a fleur-de-lis 360, and she's having hers in August. So those are basically the people that I know of. Oh my God, these squirrels. Oh, Mel, I wish I could find a squirrel. I can just hear them. I wish I could find a squirrel to put on camera for you. Probably just chipmunk. So guys, I know this video is really long. I wasn't expecting to have like those major feels. So I hope you enjoyed the skin flick part of it. I felt like it was a really redundant. I felt like I should be showing you more skin and more angles and all this stuff, but I hope it's a little eye-opening, because I've been told several times, you don't need plastic surgery, you don't have any extra skin, and I'm just really great at covering it. So I hope that this is a little eye-opening to you guys, that yeah, I'm just gonna say that. So stay tuned for the skin. Okay, so this is the skin part of the video. If I look a little different, I'm filming this part first and the sit down feels part second, even though I'm gonna put that part in the beginning of the video. So we're gonna start with boobs, and the best way that I could show you, I guess, why I'm getting them fixed, is just to wear a wife beater with no bra on. This isn't the best set up an angle. I wish that I could do like a vertical video, but a lot of people don't like when you post those on YouTube. So I'll see if I can show you basically the issues that I have with my breasts as they are. So, and also, I'm sorry when I show you my arms, I haven't shaved yet. I have to be freshly shaved for tomorrow, so I'm doing it in the morning. So if you see a little fuzz under there, I apologize. All right, hold on. Okay, so this isn't the best angle to show it, but my left breast is a little bit lower and larger than my right. And I actually look like from this angle, I actually look like I have boobs, but let me show you from the side. So this is my pec muscle. You can kind of see that line right there. This is where my breast is. And so now you can see what my breast actually looks like. So that angle is very deceiving. I have like no volume left in my breast. It's pretty much all skin, and it's just so much lower than it should be. So when I put my bathing suit top on, so the rest of this I'm going to be showing you pretty much in a bikini. So when I put my bathing suit top on, you'll be able to see like the loose skin issues surrounding it, but I basically just wanted to show what I'm getting corrected and why. So bathing suit is next. This is not attractive in the slightest. I did not hoist these babies up. This is like as they are. So I will just get into it, I guess. So you can see that my breasts are saggy. You can see the skin there. And just the fact that they are, I mean, you can even see right there, you can see where like my pec muscle is and this skin. All right, so let's just start with the arms since we already went over boobs mostly because they're gonna be connected. So when I flex, my arms aren't that bad, but if I show you like this angle here, this is all, you know, my extra skin. And when I do like that, when I do this, when I go from this side, sorry, I just had a bra on, so that's the marks that you're seeing. So basically all of this here will be removed. And I know I do not have the worst arms in the world, but it's honestly like what I'm most self-conscious about. So that will all be removed, and then it is going to connect into my breast lifts here. So this all, I'm like trying to show you the best way, but see all this like here? And I'm also going to be like showing you the different thickness of the skin and all that stuff because I definitely like the skin in the front of my stomach is thick. It still has fat in it, but like the skin on my sides is really thin and has no fat in it. So this is obviously still very thick. That will get lipoed. This is just all loose skin. I'm like a flying squirrel, basically. Like, so that is all going to be removed here, and it's going to connect down there, but you can see like that's just all, and it's worse over here actually. You can see it there. It's just all thin loose skin, and you know, my arm is the same on this side as it is on the other. It actually might be a little bit worse over here. But you can see all this wrinkling here. There's nothing in there. All right, so that's pretty much it for my upper body. I think I'm just showing you guys the same things over and over. All right, so stomach. Let's see if I can do it where you are now. Let's shorten you. Oh, I can't. Sorry, this is like a shit show. Okay. So, and you're gonna get boobs in here too. This isn't the best angle to show you my stomach. It actually looks way better from this angle. Hold on. Let me get you on the windowsill. Oh, and this is a good angle to show you actually. Sorry guys, I probably should have set up way before this. Okay, so this is my stomach. Let me straighten you out. So if I lean forward, you can see that this is all loose skin and there is still fat in there. And if I lean forward from the side, that's just all loose skin. So, but if I turn this way, you can see that this all here has like no fat left in it, and same over here. And you guys are seeing my tattoos that will get fucked up. Like this one is the one that I was talking about getting screwed up under my arm. So yeah, I mean, if I do this, that kind of shows what I'll be left with, but then it'll be even more because it's gonna take into consideration the back. So let me show you why I'm getting a 360 and not just a tummy tuck. So there's strings back here, but I don't want to flash you, hold on. If you can see, there's like, see all the like wrinkles up here from the loose skin, and then like all of those wrinkles there. That, and then the fact that I have like these lines down here, and like this is all just extra skin back here. So when I get the 360 and this is all removed, it's basically gonna do this. And same thing from the side here and from the front. It'll do that on the sides. And that there, I mean, it's just like, I can't really even picture what my body is going to look like after all of this is removed. It's just a little crazy. So this is the back tattoo that I'm thinking will probably get cut off around here, but I'm hoping she can just remove the whole thing, but I think it's probably going to get cut off right around here. This one should be fine. I think the one in the center should be fine. This one I hope will be right underneath here, but I think that this top part might get screwed up. And then, you know, nothing's getting done to my thighs, so I think that's pretty sufficient for the loose skin part, although I did kind of want to show you a different angle of my stomach when I'm sitting. So, you know, when I stand, I don't have the big overhang. Like, it just overhangs a little bit. It's just very loose in the interim. That's hot, right? So what I wanted to show you really, I guess, is when I sit down, it just, you know, like sits on my thighs, kind of. So this will all be smooth, and that will be gone here. And, you know, this over here. I do have, like, my left love handle, or my left love handle over here is a little bit bigger than my right one over here, so I'm sure she'll do a little bit more lipo on my left side than my right side. But yeah, overall, that's my bod. This is my pre-surgery body. Like I said, I really can't wrap my head around the fact that I am not gonna have this on my body anymore. I can't even begin to imagine what it's gonna look like. Like, just putting my hand on my ribs and moving around all this like extra skin here. I can't believe like that I'm not gonna be doing that. I don't know. Okay, so this is the end of the video, I guess. I might make a very, very short, like on my way to the hospital video or something. Maybe like a last minute thoughts tonight and like an on my way to the hospital tomorrow. We'll see. But yeah, until next time.